Namaskar to everyone. Myself, Dr. Kartavya. I'm a family physician based in Gurgaon with my own setup by the name Family Health Point. So the topic for today for me is the dissolution technique in the Telmisartan formulations. As we all know that Telmisartan is one of the very commonly used and well-approved drug for the control of BP, for hypertension. So Telmisartan, which is a angiotensin receptor blocker, is approved for hypertension, and it basically binds to angiotensin receptor 1 with high affinity, causing inhibition of the action of angiotensin 2 on vascular smooth muscles, ultimately leading to a reduction in arterial blood pressure. So the basically solubility of Telmisartan is in aqueous solution is strongly pH dependent, with maximum solubility observed at high and low pH. It is seen that there are different brands of Telmisartan which may not produce equally desirable clinical effects at the same dose, and thus variability in therapeutic response is one of the problems with Telmisartan. So the factors responsible for this therapeutic response are highly variable. The pharmacokinetic properties like excessive first pass metabolism, low solubility, high permeability, as BCS class 2 drug presence of food, use of excipients, diluent, lubricants. And it has been observed that absolute bioavailability of Telmisartan is about 42% at 40 milligram and 57% at 160 milligram. The solubility in aqueous solutions is strongly pH dependent, as I already shared that, with maximum solubility observed at high and low pH levels, that is ranging between pH 3 to 9. So the poor solubility which results in low bioavailability. After we ingest the tablet, after the ingestion, tablet undergoes disintegration and dissolution before being absorbed, rate and extent of which into the systemic circulation determines its bioavailability. The solubility dissolution behavior of a drug is key determinant to its oral bioavailability, which is a rate limiting step to drug absorption. Poor solubility results in low bioavailability, leads to large inter and intra-subject variation and large variations in blood drug concentration under fed versus fasted conditions. If the drug does not dissolve readily or cannot penetrate the epithelial membrane, for example, if it's highly ionized or polar membrane, time at the absorption site may be insufficient. Bioavailability tends to be highly variable and low. As we know that with any oral preparation, drug dissolution profiles may be distinct due to differences in formulation and manufacturing product processes. Sodium hydroxide is considered as a strong alkalizer as it provides maximum solubility of Telmisartan. Some of the generic and innovator brand contains sodium hydroxide, NaOH, and it creates a microenvironmental pH around Telmisartan granules and thus enhance solubility of Telmisartan in the intestinal fluid. A unique technology is used by companies wherein micronized Telmisartan granules primarily mixed with suitable alkalizer, preferably sodium hydroxide, and there has been a randomized studies conducted to assess bioavailability in the tablet formulations. So the features of Telmisartan dissolution profile: NaOH, sodium hydroxide, is a strong base used to dissolve as a drug is soluble in a strong base. Alkalizer used for improving dissolution profile in Telmisartan tablet is as per innovator based brand Telmisartan. The dissolution medium selected is pH 7.5 phosphate buffer, which is a media specified for Telmisartan tablets as per FDA OGD guidelines. USP requires not less than 75% of the label amount dissolved within 30 minutes. pH 7.5 is the recommended buffer pH in the United States Pharmacopoeia. USP: development of dissolution method was validated in accordance with ICH guidelines because providing the method is experimentally sound, yielding precise, accurate, and repeatable results. So this was the small update about the bioavailability of Telmisartan and what does dissolution technique with Telmisartan formulation mean. Thanks to everyone.